I rise with some concerns about many sections of the bill. I was very happy to see that we did remove one section of the safe injection sites. But Madam Speaker, I think the theme of the 2025 legislative session is just in case. You're going to hear me say that throughout this entire session and today. A lot of legislation we're doing up here this year is just in case something happens in Washington, just in case the president does something. And while I'm concerned about certain things, I don't think we should legislate just in case. So, Madam Speaker, in Section 1, the first of our just in case is just in case Washington changes the recommendation for fluoride in our water. And in Section 3, we start talking about EMTALA. So what EMTALA is, it's the Emergency Medical Treatment and Labor Act. It's a federal law. It was passed in 1986. And you know what that law does? It ensures that every person, regardless of their ability to pay, can access services in the emergency department, and regardless of the condition they're there for. So it guarantees, it's a good law, it's a good federal law, and we follow it in the state of Connecticut like we should. But, again, we're doing this just in case something happens in Washington. Section 5, that's the safe harbor section that is going to be administered by the treasurer of the state of Connecticut. This section does not belong. Madam Speaker, I have a big problem with the safe harbor section, and I know a lot of my colleagues do. How does an elected official for the state of Connecticut, where this account will be housed by donations, bequests, no state funds will be put into this account, but we're asking him to invest this money? Now, last time I checked, the treasurer is not just a 9-to-5 job, so I don't know how he can volunteer his time to do this, and or his staff. I know we're going to have a committee that's going to make those decisions of who should get this money and where it goes, but as far as people saying we're not using any state funds, I think that's false, because the treasurer will still have to use his time to do something with this account. And in Section 8 and 9, these two are pretty interesting sections. Section 8 is establishing an account known as the Public Health Urgent Communication Account. Now, originally, this account had, and I may flip the numbers, but I believe this originally had $5 million in this account. I'm going to say it, what I said I'd say in the beginning, this was one of those just-in-case sections, and it's a just-in-case account. Something may happen in DC and we lose funding. But now they strip the money out of it, so now it's the equivalent of a dummy bill or a slush fund. We don't know if and when any money will come in and out of this account, and we don't know how it's going to be regulated. We don't know who's going to have control over it. And Madam Speaker, it's similar in Section 9. It's establishing an emergency public health financial safeguard account. That one had $30 million in it. The other one had $5 million in. Same thing. There's no monies in there, so it's just, these are two accounts we're creating in case something happens in Washington. I just encourage my fellow legislators to think long and hard about this legislation here today. I said in the beginning of my questions that there are a lot of just-in-cases here today. I'm a firm believer that we need to address shortfalls as they become available or they're presented to us, but I don't believe that a lot of the bills, separate bills, and the sections of this bill here today really cover what we're intending to cover. Thank you, Mr. Speaker.